Hi, my name is Sabah. I belong to Universidad de Sagrado Corazón. I'm going to be demonstrating on how to do a uterine massage on the mother. The purpose for this is to reduce bleeding and cramping of the uterus after childbirth. As the uterus returns back to its non-pregnant size, its muscles contract very strongly, and it can cause a lot of pain for the mother. So what we're going to do is we're going to come into the patient's room. We're going to provide privacy. I'm going to cover the patient up for privacy. Okay. After I provide privacy, I'm going to make sure that the patient went to the bathroom to empty out her bladder. After the patient empties out her bladder, I make the patient comfortable again. Then I'm going to do hand hygiene. Always do hand hygiene, wash my hands, and put on gloves. After I do that, I'm going to gather my equipment, which all I need is a pad for the patient. After the patient is comfortable in a supine position with her legs flexed, I'm going to assess the patient. So what I'm going to do is I'm going to palpate to make sure that there's no distension or swelling on the uterus, on the uterine area. So there is no swelling or distension, which is good. The next thing we're going to do is we're going to pretty much explain the procedure to the family and to the patient. Let them know what I'm doing, which is a uterine massage. Then I'm going to localize the position of the uterus, and I'm going to using the belly button. So I'm going to localize the uterus using the belly button as the reference. So what I'm going to do, so the belly button is here, okay? So I'm going to place my hands at the bottom where the pubic symphysis is at, and I'm going to place my other hand on the fundal part of the belly, and I'm going to start massaging. After I start massaging, I'm going to just put a little bit of pressure here and keep massaging. After I massage, I'm going to offer perineal care on the patient. I'm going to take the bloody pad out and I'm going to put on a new pad. Okay. After I do the perineal care, I'm going to place a new pad in, okay, on the patient. Okay, after that's done, I want to make sure reassess palpation of the uterine after 15 minutes of the fundal massage. So I'm going to palpate again after 15 minutes of the fundal massage. Okay. So after the perineal care is done and I put on the new pad, and the patient is comfortable, we're going to come here and we're going to look at how the bloody pad looks. So there's 3 types of bloody pads, and it's called a lochia. So there's lochia rubra, lochia serosa, and lochia alba. So if the pad that I took out from the mother, if the pad looks like this is a lochia rubra pad, okay? And it is the first stage, and it is dark red in color, and it is four days long. The second one is the lochia serosa, which is like a pinkish color, and this lasts for like 10 days long. 10 days. And then this lochia alba, and this is the third stage, and it's like a whitish yellow color, and it's 10 days to 14 days long. Okay, so from what I see from the patient's old pad that she was using, she had stage 2, which is Loquias serosa, which is a pinkish color. Okay, so after I gather all of my findings throughout the massage and the lochia color of the patient, I'm going to document everything I did. I'm gonna take off my gloves, wash my hands, hand hygiene, take off my gloves, make sure the patient is comfortable, ask if she needs anything, and I'm going to document my findings after. Thank you.